Definition of rheumatoid arthritis. ASSCISPP. Autoimmune systemic symmetrical chronic inflammatory polyarteritis that involves small peripheral joints. How much time is taken to make a diagnosis of rheumatoid arthritis? 6 weeks cause it's a chronic disease. After how long? RA is categorized as chronic stabilized RA. Or patient gets deformities. 2 years. What upper limb joints are involved in RA? PIP proximal interphalangeal, MCP metacarpophalangeal. What axial joints are involved in RA? Atlantoaxial joint. What lower limb joints are involved in RA? 5th MTP metatarsophalangeal. What other joints are involved in RA? 1. TMJ temporomandibular joint. 2. Cricoretinoid joint. What upper limb joints are spared in RA? 1. DIP distal interphalangeal. 2. First CMC carpometacarpal. What axial joints are spared in RA? Thoracic, lumbar, sacral vertebra. What lower limb joints are spared in RA? First MTP. How many percentage of patients of RA gets extra-articular manifestation, an MC? 40%. MC, rheumatic nodules. DIP joint is involved in what condition? 1. Psoriatic arthritis. 2. Osteoarthritis. 3. Multicentric reticulohistiocytosis. 4. Pseudo-gout. Main pathogenesis events in RA. Abnormal protein modification happens, which eventually leads to chronic synovitis. Example of abnormal protein modification in RA. Citrullination, carbamylation. Key pathogenic cytokine in RA. TNF, alpha. T cells lineages involved in pathogenesis of RA. Th1 greater than Th17 greater than Th2. House pan is formed in RA. T cells along with neutrophil migrated to joint space and cause synovial hypertrophy, forming pannus and eventually leading to periarticular erosion. What's pannus? Inflamed granulation tissue rich in inflammatory cells and fibroblasts within joint space. In RA, TNF alpha activates osteoclasts through which pathway? Rank ligand. In RA, TNF alpha inhibits osteoblasts through which pathway? 1 Danish Krona pathway. HLA factors associated with RA. DRB104, Dr. 13, Dr. 1, Dr. 14. Which HLA factors in RA is associated with protection? DR-13. Name of shared epitome of HLA Dr. B104 in RA. QKRAA motive. Non-HLA, genetic factors associated with RA. PADI4, PTPN22. What's PADI4? Peptidyl arginine deaminase 4, its post-translation modification of arginine to citrulline. Among PADI4 and PTPN22, which one is seen in Asians? PADI4. Environmental factors harmful for RA. Smoking, silica. Environmental factors protective for RA. Alcohol, OCP. Males-females ratio in RA. M. F equals 1, 3. Impact of pregnancy on RA. Induce remission through IL-10. Which infection is associated with RA? Chronic periodontitis. Organism, Porphyromonas gingivalis. Risk prediction in RA, factors and score. Age, female, joint distribution, swollen joint, tender joint. CRP, rheumatoid factor, anti-CCP antibody. Score greater than 8 means there are 80% chances for undifferentiated arthritis to progress to RA. Anti-CCP antibody full form and aka cyclical citrullonated polypeptide AB, aka ACPA and MCV. Specificity of anti-CCP antibody and rheumatoid factor in RA. Anti-CCP, high. RF, low. What does high titers of anti-CCP antibody and rheumatoid factor in RA denote? Suggestive of extra-articular manifestation. Rheumatoid factor is nonspecific and hence can also be found in other conditions like cryoglobulinemia, Sjogren's, juvenile idiopathic arthritis. 5% normal people, leprosy, i.e., PBC, silicosis, sarcoid, HBV, HCV. What's rheumatoid factor? It's IgM antibody against Fc portion of Ig. Marker of relapse in RA. CRP, ESR. Presentation of articular manifestation of RA. Insidious chronic inflammatory symmetrical peripheral polyarteritis. Presentation of articular manifestation of RA, in elderly. 1. Acute destructive polyarteritis. 2. Mimics polymyalgia rheumatic PMR. 3. Arthritis robustus, minimal symptoms but erosions on X-ray present. Presentation of articular manifestation of RA, in young girls. Called palindromic rheumatism, acute episodic monoarthritis, which resolves completely and then involve other joints. Which antibody is positive in palindromic rheumatism? Anticarb carbamylated peptide. Reversible deformities in RA. 1. Zigzag deformity first change. 2. Piano key deformity. 3. Hitchhiker's thumb. 4. Trigger finger. What's zigzag deformity? 1. Radial deviation at wrist. 2. Ulnar deviation at MCP. 3. Extension of interphalangeal joints. What's piano key deformity? Rupture of ulnar collateral ligament and deformity of ulnar styloid. What's hitchhiker's thumb deformity? Abduction and hyperextension of thumb, Z-shaped thumb. Irreversible deformities in RA. Takes at least 2 years to appear. 1. Swan neck deformity. 2. Boutonniere deformity. 3. Opera glass hand deformity. 4. Von Jackson deformity. 5. Intrinsic plus deformity. What's swan neck deformity? 1. Hyperextension of PIP. 2. Flexion of DIP. 3. Rupture of FDS, flexor digitalis superficialis. What's boutonniere deformity? Hyperextension of DIP, flexion of PIP, synovitis of PIP. What's opera glass hand deformity? Arthritis mutilans. What's von Jackson deformity? Impaired medial extensor tendon. What's intrinsic plus deformity? 1. Tightness of intrinsic muscle. 2. Hyperflexion of MCP. 3. Extension of interphalangeal joints. Pointing index finger is seen due to which nerve palsy? Median nerve palsy. Lower limb deformities in RA. Hammer toe, hallux valgus, pes planus, ankle valgus, forefoot varus. Extraarticular manifestation of RA. 1. Rheumatoid nodules. 2. Calf pain, swelling. 3. Baker's cyst. 4. CNS, CVS, respi, eye, blood gut endocrine skin kidney system wise. Rheumatoid nodules features. Painless, seen in pressure area elbow, fingers. Granulomatous type 4 hypersensitivity. Differential diagnosis for ruptured Baker's cyst. Deep vein thrombosis. Effect of RA on cognitive function. Normal, no cognitive decline. CNS extraarticular manifestation of RA. Atlantoaxial subluxation leading to acute onset quadriparesis, erosion of odontoid process. Ocular extraarticular manifestation of RA. Episcleritis M.C. Scleritis, keratoconjunctivitis sicca, no uveitis. Vascular extraarticular manifestation of RA. Accelerated atherosclerosis, antiphospholipid syndrome, vasculitis. Hematological extraarticular manifestation of RA. Anemia of century disease. Warm antibody AIHA. Secondary ITP. Felty syndrome. Risk of DLBCL. What's Felty syndrome? Ra plus neutropenia plus splenomegaly. CVS extraarticular manifestation of RA. 1. Pericarditis without tamponade. 2. Mitral regurgitation. 3. Acute coronary syndrome. Endocrine extraarticular manifestation of RA. Osteoporosis, hypoandrogenism. Skin extraarticular manifestation of RA. Rheumatoid nodule, pyoderma gangrenosum. Respiratory extraarticular manifestation of RA. Pleuritis plus pleural effusion, ILD, UIP. Kaplan syndrome, COPD. What's Kaplan syndrome? Ra plus synovitis plus IgA rheumatoid factor antibody positive. Renal extraarticular manifestation of RA. Relative sparing, amyloidosis AA, membranous nephropathy. MCILD associated with CTDs. NSIP. Most common ILD associated with sarcoid. Upper lobe NSIP. Most common ILD associated with Sjogren. Lip. Most common ILD associated with antisynthetase syndrome. COP cryogenic organizing pneumonia. Conventional DMARDS used in treatment of RA. Methotrexate, leflunomide, sulfasalazine, hydroxychloroquine. Biological agents used in treatment of RA. 1. Anti-TNF-alpha, rituximab, etanercept, adalimumab. 2. Anti-CD20 rituximab. 3. Anti-IL-1 anakinra. 4. Anti-IL-6 tocilizumab. 5. Fusion CTLA-4 FSIG, abatacept. JAK inhibitors used in treatment of RA. Tofacitinib, baricitinib. Role of steroids in treatment of RA. Acts as bridge therapy for DMARDS. Complications of first-line therapy with methotrexate in RA. 1. Mucositis MC. 2. Bone marrow suppression. 3. Liver failure. 4. Allergy. Remission criteria in RA. Boolean definition, tender joint, swollen, C-reactive protein, global assessment, all should be equal or less than 1. Treatment options if no response after 3 months of methotrexate. 1. Methotrexate plus sulfasalazine plus hydroxychloroquine. 2. Methotrexate plus anti-TNF-alpha. 3. Methotrexate plus JAK inhibitors.